Dr Mpume Zenda, thank you so much for joining us here on CheckPoint, the podcast.
Ma'am, thank you for having me.
We are turning 12 in April.
Right.
And we started this podcast to sort of look back at the issues that we've covered on the show and look at where they are, where they were at the time that we covered them, and where they are now. And one of the issues that I know is very close to your heart is the issue of, I call it child mothers.
Yes.
I think teen pregnancy, I'm uncomfortable with that word because teen pregnancy, it's almost like you naughty girl. Whereas with some of these children, they are children.
Yes.
A crime has been committed here. So we've covered the criminal side, legal side, psychological side, and I need you to start talking to us about the medical side.
Absolutely. Yeah.
The physiological trauma that childbirth is and pregnancy is to a teenager.
Right.
What happens?
Even before we get to the trauma, I like how you started in terms of your discomfort with the teenage, because if you look at the menstrual debut these days, you're finding 10-year-olds. 10 years are not teens as yet. And so...
and they're falling pregnant, they're menstruating.
Because we are seeing menstruation starting for a number of medical reasons, starting earlier than what we have seen probably in the past couple of decades.
Just take us to why.
Sure. A lot of it has to do with, so there is an amount, a certain percentage of fat that a girl needs to have for that. It's a brain, it's a brain excess of hormones that gets triggered that then starts it. So there is definitely the hereditary. So if in the family, mom, siblings started a bit earlier, that is a factor. But the big one, if you look at our diet, how it has changed, we have a huge surge in adolescent obesity. So that is one of the big ones in terms of just the amount of actual fat percentage in their
tissue,
bodies.
Basically.
Adipose tissue, which also then kind of lends to that element of what are we eating? What are we feeding our children? The activities. We used to play around, outside, when we were young. These days, this is what play looks like. It's on the gadget, it's on the screens.
We're sitting, we're not moving.
There's a sedentary lifestyle that is sipping from the parents to the children, and therefore we're looking at our society with such high obesity levels, and one of the big factors actually is why we are seeing that earlier.
Sure.
Menstruation.
Okay.
So it's inaccurate of us actually to say it's teenage pregnancy when you've got 10-year-olds falling pregnant. And when it comes to the physical trauma, and I think even then your question is specific to what happens to that child that is pregnant.
Because my thinking is that, sorry to interrupt you, doctor, I've given birth before, I've been pregnant before. It's hectic.
Yeah.
And I just think of what I went through, and I think of myself as a 10-year-old.
Yes.
And it frightens me, honestly.
Yeah.
And I don't know, correct me if I'm wrong, but it's my understanding that many of them die.
Yes. When you look at the mortality rate, it's highest in the extremes of ages, be it, the young, very young, or the ones that are a little bit older, because of the medical consequences or risks that they tend to have. So
it's mom and baby.
It's mom and baby. Yeah. They have a higher rate of infant mortality, as well as maternal mortality. So the one that's pregnant and the one that is in the womb. And I wanted to allude to that you're not just looking at one child when there is an adolescent pregnancy. You're looking at two children. So it's the one that's carrying and the one that's inside. And I think that should make us stop for a moment and say, okay, how do we kind of come around the situation and lend... when you send me the brief again, it was we don't want to talk about the stigma, the stereotype. We if you are a parent, I'm a parent of a 16-year-old. how do I make this space called our world, our society, our community safe enough for her to grow old enough to get to a point where she's able to make that kind of decision for herself.
She can decide.
She can
for
decide.
herself.
The other beautiful thing, another thing that we often don't understand about teenagers is that their bodies actually kind of matures faster than their brains. And even in the brain factor, their emotional part of their brain actually kind of speeds up way more or faster. The cortex or the frontal cortex, the parts that actually give you that element of being able to see the future and say the decisions I'm making today are going to affect me in the future, that only really matures at about 24 years of age. So you've got somebody at 10, 11, 12 years raging hormones because, whether it's the body structure, because, genetic factors, but puberty, you can't stop it. Once it's there and it goes. They've got these raging hormones and their body is changing. How many 13, 14-year-olds do you kind of look at today and be like, how old are you? In the way that they look, right? And there's nothing wrong with that, but it's putting it into context from a perspective of just because your body looks grown and is growing, it doesn't mean, first of all, your mind has matured enough to make the kind of decisions. Now, decision making comes in very importantly because when you think about all the risk factors, start from even just before they fall pregnant, we often talk about things like preconception care. This is somebody who is likely knows nothing about that, let alone their own menstruating bodies.
Second, this is a child.
This is a child. Yeah. So things, for example, like that we would give folic acid to prevent things like what we call, the word just left me. Basically, spinal neurospinal defects. That's why we give the folic acid at least 6 months prior to the pregnancy. So already you have somebody who this was unplanned. It kind of just happened.
It happened to them.
Yes, I would say it happens to them, but it happens to the whole ecosystem. Because when a teenager falls pregnant, I think gone are the days where we're like, you naughty girl. We kind of think to ourselves, okay, what environment is this child growing up in, and what conversations are being had or were had with the parents or the guardians that look after this young one.
Many of the times conversations are not being had, and we've been in homes where children have given birth to children.
Yeah.
And we ask the parents, like, what does she say? And the parent says, we haven't spoken about it.
Yeah.
So they never spoke about this before.
Yeah.
They didn't speak about it while she was pregnant.
In fact,
and they're not speaking about it now.
They are going to hide it until they can't hide it anymore, because pregnancy will announce itself eventually. So it's like I said, prenatally, this infant is already exposed or is at risk of defects like that. And then because of the context that generally these pregnancies happen, prenatal care, how often do you think they're going to actually go? And I've had a situation in this day and age where I've had a girl walk into an emergency unit full on pregnant, and the parents had no idea. And now we're at a point where we must deliver this baby and go back to the conversations that should have been had. They've never attended any clinic or healthcare provider to basically just facilitate that the pregnancy is going accordingly. And it's not just only to look after that the pregnancy is going accordingly, but it's also, that's where we kind of get opportunities to do education about things like danger signs. If you start bleeding during pregnancy, if the baby is not moving enough, or the movements have decreased, when should you be alarmed to go and see a healthcare provider? So risky conditions like anemia are rife amongst teenage pregnancy or adolescent pregnancies. Things like stillbirths, things like preterm delivery or premature delivery, miscarriages are much higher. And for the mom in particular, things like hypertension, hyper-induced hypertension or hypertension during pregnancy, and the severe form, which is preeclampsia, which is one of the top 5 causes of maternal mortality in South Africa. They are worse off and more common in the pregnancy the younger they are. So you're already looking at these things and saying the start is not good at all.
It's almost like attempted murder to me. I mean, it's statutory rape in many of these cases, but it's a life, 2 lives. Actually,
and you know, you talk about something quite interesting, and I hear you. When I was working in public health in the West Rand, I did, it wasn't like a research, but I just took an initiative in terms of seeing all the teenage pregnancies that came. And you know what was actually really interesting? We often assume that all teenage pregnancies are as a result of, you know, statutory rape or an older somebody. But actually, I think in the group that I had, probably 60-70% was actually peer fathers. So remember that we are not just dealing with a teenage or an adolescent girl whose life has been turned upside down. If it is a peer, it means it's a 10-year-old and an 11-year-old or a 13-year-old.
We've spoken to a 17-year-old, I mean, a 14-year-old whose child's father was a 17-year-old.
Yes.
But the law states that if the 17-year-old is more than 2 years older than the child, then it still is statutory rape, even if it's
and
peer.
We see. I'm glad I'm not a lawyer or I'm not in the legal space. I'm a physician. I am a clinician.
But you're making the point that some of these children
are having children with children.
Yes.
And even if a 13-year-old and a 15-year-old, they're still children. But when you think about a 15-year-old boy who now has to think about a father, a child.
Yeah, they run away, most of them. And they never see them again. They never see the fathers again.
True. But here it is again, Nkepile. Again, I think for me, what has been really fundamental is to not look at the one side without understanding what's happening on the other side.
You mean the boys and the girls?
Okay. Sure. The boys generally will get to be the ones between the two parties involved, will get to be the one who finishes school, who maybe graduates and maybe runs away. But also, remember, nobody gets away scot-free. And those who have parents, I've known families where the parents of the boy kind of take responsibility and they raise the child.
They have to by law, you know, when both are minors.
You know, and so I think we cannot kind of narrow stream the conversation.
I see what you mean. Yes.
And fair enough. I get that the real scourge of what we've experienced in our country and maybe in other parts of Africa is the girl child being left behind because they're the ones who are carrying. But I think it's always important to just be like, it's that's why I said earlier on, it's the whole ecosystem. Now they're pregnant, they go through the pregnancy, delivery.
Can I just go back to while they're pregnant?
Yeah, sure.
The stress of it all, of I have shamed my family, or am I going to go back to school, or I'm a baby carrying a baby, or what conditions are the infant living in? Yeah. Stress, in utero.
Absolutely.
Under that stress.
Yeah. So under stressful conditions, and that's why things like hypertension for the mom becomes a risk factor, but for the baby, it's low birth weight, it's preterm delivery. And remember, because they are minors, even if they're not necessarily continuing to engage in sexual intimacy whilst they're pregnant, they are at higher risk of sexually transmitted infections as well. Particularly HIV, things like chlamydia, which may actually predispose them to other complications later on in life when they do, or they are making the decisions with more clearer and just with all their faculties in place. And so you get sort of like the immediate repercussions, but you also get sort of like the long term. So that stressor is a big one. Again, like I said, very often they are hiding the pregnancy, which means they're not getting their prenatal vitamins, risks of things like anemia. They're not getting their checkups. So if they had anything like that, we would check for in the 10-week visit, things like rubella that would affect the child, things like hepatitis and so forth. All those things are not checked. So any of those infections can be passed on to the child.
And then you were going to talk about the delivery.
Yeah. You get to the delivery and it for me, I can never separate, again, a stressor or a mental of just having now to go to, let's say, if they are lucky enough, they've told the parents they kind of can get private care, which is very different. But also the shame of showing up at a labor ward where it's your mom's peers that are having to deliver you, having sometimes they get to be treated less than. Sometimes they are reprimanded by the very healthcare providers that are supposed to be kind of caring for them. So already they are at a disadvantage, even as they walk into a healthcare facility, in terms of they may be even shy to say, I'm in a lot of pain, and so endure a labor in the most traumatizing and barbaric way, because when how can you even say you want something for pain when you felt pregnant in your right?
We were not there when you were
even
doing
if
whatever.
Nobody says it. We often think that people shame us in what they say, but sometimes it's just a look. It's just a look of condemnation. It's just a look of how could you? And very often there's not enough grace in that space. Now we get to the actual delivery. They are more prone to first of all, they are more prone to having a cesarean section. They are more prone, if they do have a vaginal delivery, they're more prone to having traumatic tears that may be more, when we call perineal tears, we grade them. So anything above 3 that may impact their 3 to 4 that impacts their anal region. Again, those repercussions may go on to affect their sexual pleasure life going forward.
Forever and
ever. They may impact, if they ended up with the fistula, which is basically a communication between the anal region, the rectum, and the vagina. That means that person lives with this kind of very, very traumatizing condition. The surgical, from the surgery perspective, to just people having to have what we call a colostomy, which, we basically divert the exit.
You lose your functions,
basically. Lose your functions, basically. So it's the tears and recovery. Recovering, whether you're recovering from a cesarean section or from those tears, being at risk of infection, post-delivery infections, much higher. I often say, again, I you kind of wear these hats where, yes, you are a clinician, but you're also a mom and you're also a girl. I mean, at 10 years, at 13, at 14, you haven't even figured out your own hygiene properly. How do you look after yourself post-delivery and avoid infection or minimize infection? And over and above that, how do you look after this human being?
Yeah. How do we turn the tide? I mean, the latest statistics are that between January 2024 and February 2025, 123,000 children were born to children. You're filling F&B and Wanderers together, combined. Children of children.
What is happening in our homes? And that's why when we started off, I said, we have to get past the stage where we're looking at this 14-year-old and saying, bad, bad, bad. We need to say what's happening in their environment. Maybe to allude back to the teens I used to see when I was in public health, that group of girls. What was really interesting, and our data tells us, it was a lot of the times the children who did not have stable environments in terms of guardians. And I say guardians because not everybody is raised
as a mom and dad,
and a mom and dad.
Yeah.
And that was the big one, poverty. The other big one, and poverty kind of plays into this one is, and I allude to it in the book, is it's well and good for us as parents to say, don't do, but we don't spend enough time giving them what they should be doing.
Yeah.
So where there are no extracurricular activities, where they are not encouraged to play and be themselves and explore their, I mean, when you look at a boy child, for example, when they start puberty, it is a surge of testosterone. And so it's like being given a Ferrari, but you don't have a driver's license yet. You need somebody to hold your hand whilst you park the Ferrari and say, this is how you actually drive. So a lot of them have no idea what to do with their sexual urges, which is a natural part of growing up. Now you've got all the time because after school, mom or dad or whoever is looking after us, they only come back,
Much
after
later.
work. They work till late.
Yeah.
All I do is watch television or play with my friends. And if I'm also not having conversations with my parents, it means the only information I have is either through my peers or what I'm seeing on the digital. And we can't escape the fact that social media platforms, in terms of the information, accurate information is there.
It is there. This is the thing.
If you just for free, where do people, and I see this all the time, even adults like us, you'll find somebody walking in and be like, I saw this on TikTok. And you're like, TikTok?
That's
Google?
Where you get your information.
That's where you get your information, right? And I understand it. I'm biased because I'm a clinician. I know where to look and how to look. Even when I go to Google, we know how to look for credible articles and so forth.
Yeah.
So going back to how and how do we turn the tide? If we as parents, and not just parents to our own children, but parents to the children of our communities, if we are not having the conversations, we are dead underwater.
They are having the conversations elsewhere.
And
they're getting the wrong information.
And if you are thinking you're just going to close your eyes and pray that they survive the teenage phase, we are in trouble.
Yeah. But also teenagers listen to other teenagers.
Yes and no.
Oh, okay.
Yes and no. And I think as parents, I don't know how to stress the point of how much influence you have on your child. But that influence, you will reap the benefits of it, and your child will get the benefits of it when you've gone into a space where you've created a safe space for those conversations. It's not a don't do and don't. It's let's have a conversation. And there's nothing wrong with not knowing as a parent, because again, as a parent, I often say this, my mother is a retired midwife and was great at talking about these conversations with other people's children, but not with me.
Not with you.
And that's where I say sometimes culture and socialization will trump education, hands down. She had the information, and all she could say to me as a child, starting my periods, if you play with boys, stay. In fact, she was like, hey, Mtanami, we are very fertile in this family.
Oh,
and so one move is one touch is a move, you know.
Yeah.
And it was hurtful because what it said to me was, I've done something wrong.
Not explain why.
Yeah. And also, I think where we often just think about the ills of not having those conversations, like teenage pregnancy, drug abuse, but we also don't think about the fact that we teach, whether it's particularly when it comes to girls, we are then teaching them to feel ashamed of the natural processes of their bodies. And yet, at some point, these are the people who are going to have sexual and intimate relationship with somebody. And you wonder why sometimes, even as women, we fumble the whole thing of consent. We don't know how to say no, or we are afraid to speak up, or to be like, my no is a no. Or something has happened. We don't know how to go and speak up about those things, purely because we've always thought something is wrong with me.
Sure. We interviewed a mother of a teenage mom, and she said, I knew this was going to happen because just the way she was carrying on. She would just go out, never listen to me, and I knew, so I'm not surprised. And I was tired. I was tired of I was shouting at her and beating her up, and I was tired.
Single parent. Right. You know one thing, this topic is layered.
Yeah.
Because you know what happens to single parents, and whether it's the mom or it's the dad, if you are carrying the load on your own, it means, first of all, let's say as a mom, I can never be my daughter's dad. Right? And so there's a gap there that I'm also trying to fill in. But also what it does is it says, even my best version of being a mom, I cannot be if I'm having to double up as both parents. And then there's the next layer of, if I was never taught about these things, if I was just reprimanded and never kind of given a safe way of how do we deal with discipline and teaching in the household, how do I have, a lot of us grew up in families where we didn't know how to have a relationship with our parents, besides knowing that they actually are our parents. They kind of buy the food, they take us to school. But that real connection where a parent gets to see what's happening in their child's life and is invested and is curious about what's happening. What does even your child like? If I ask, a lot of us about, so what tell me about your child, the personality, who are their friends? Yeah. You find that in these kind of situations, those things are not there. And
there's a gap. It's just like
gap.
A parent
economic pressure of, if she has to work maybe even 2 jobs and just get by. That mom of a pregnant teenager or adolescent was also never equipped to, or doesn't have all the resources they needed to be able to apply themselves in parenting her. And therefore, and you're busy, as opposed to saying, what's really going on? What are the gaps? What's going on in your heart? Psychologically, why are you, why? Because when you look at teens, you have to say to yourself, the behavior is just a symptom. What's going on behind? She doesn't have time to sit with you and think, well, I'm being bullied at school and therefore that's why I'm acting out. Or I really miss my dad. I want answers about my dad who is not here, and you're not giving them because you're too busy working. I'm left to my own devices for the most part. A lot of teenagers actually in those kind of contexts, you find that they are raising themselves and raising each other, in terms of peers. And I think I have a lot of empathy for that mom, but I think there's also should be a lot of empathy for that teenager. These are 2 women in different generations, and they have not been capacitated to really be the best version of themselves in those stages.
And what is this generation that are speaking about now that's filling F&B and wondrous? What quality of human is that, having started on such a bad note?
Yeah.
In the womb.
Yeah. Oof. It again, the layers and layers. So maybe let's take the example of the mom of a 17-year-old that's pregnant.
The 14-year-old.
The 14-year-old.
The father is 17. The father of the baby is 17.
The 14-year-old. First of all, let's say that child is born prematurely. That means from a developmental perspective, we have problems. That means that infant already needs a lot more than a child that is born, full term. Where are they going to get those resources for the OTs, for the
after baby is born, the situation is worse.
It gets worse. And the demands that they have, again, like I said, take this very mom who's like, I tried, I'm tired, and guess what? Whether she likes it or not, as long as that child is in her care, she will be responsible. That's more pressure for her. That means also the toxicity of that environment psychologically for the one that was pregnant, but also for that infant neglect. We spoke about infant mortality being high. Then you get sort of like the childhood diseases, or these are the child who get nutritional deficiency diseases. I'm not a pediatrician.
Stunting,
malnutrition becomes huge, which impacts on their development in terms of their learning, in terms of just the kind of child they are. It impacts when they go to school. They are the children that are delayed in terms of their milestones, in terms of their learning capabilities. It keeps being this layered cycle of just wheels coming off at every point.
Yeah.
And of course, it impacts on their well-being. It impacts on their susceptibility to things like abuse. It impacts on their ability to grow up and be a citizen that can be like, I can work. We always speak about rights. And yes, our constitution is beautiful, but if you look at this particular situation, what rights do all these three people have? What rights can they exercise in terms of being a formidable part of a society and make an economic contribution, both for themselves and the community and the country as a whole? So I think going back, we can no longer, that whole thing of Ubuntu, it takes a village. We have to go back to that, and maybe not in the ways that it was done, back then. We have to find a way of how do we become communal? Because imagine if this mother has 3 or 4 friends that are like, okay, mzala, sizokusapota. What do you need? They come around her and they say, we're going to help see how we look after these ones.
Especially when the child shows signs of trouble.
Yeah.
At that beginning stage, she needed the help then.
Yeah. Because just because somebody's in trouble, it doesn't. You can discipline, but it doesn't mean you stop loving and supporting and that's punishment. And that is lifelong punishment. If you're saying to somebody, well, I'm not going to take you to school anymore because you fell pregnant. That's punishment. That's not discipline. Right? And I think the way that we are raising our children has to go back to not just raising our womb children, but how are we raising our communities?
Should we be emphasizing all of these medical hazards more as a society?
Yes and no.
It can mean death.
Yeah. Well, like I said, women are more likely to die from pregnancy than they are from being hit by a car. Facts. Right? I knew that if the mom down the next door sees me doing funny things, they would equally reprimand me and discipline me the same way that my mother would. In this day and age, your child is your child, my child is my child. Do not touch. I will not touch. I will not say anything, right? But also what that has done again, that communalness, even when I see a child that's in trouble, we drive past, right?
It's not my
And so the era we are in, we can no longer do the dictatorship thing that our parents got away with, but we are also ill-equipped to have the conversations that are safer. A lot of us don't know how to talk to our children just about menstruation, about their bodies, about the beauty of your body changing, and ultimately empowering. We still are riding on what our parents fed us. If you play with boys, you're going to. And we think that's going to hack it in this day and age.
Yeah.
And we also are not very upfront about, I don't know where to start.
Getting help.
A parent, exactly. And getting the help. We are the hope and pray. And unfortunately, in the digital space that we live in, there is no way. And you look at the rates of sexually transmitted infections. We're seeing, if you look at the HIV new infections, they are the highest amongst girls between the ages of 14 and 24.
Yeah.
Right?
Yeah.
And HIV is still doing the same thing that it's been doing for decades that it's been around. And the reality of it is, we have to go back to that. Well, not back because it was never really there. We have to change the way that we are parenting and having the conversations with our children and being invested and involved in our children's life. Schools are not going to do it for us. Teachers are not going to do it for us.
Yeah, because there is sex education at school, but clearly it's not working. And
the curriculum is actually not bad, because I know it's sort of like back and front. It's actually a good curriculum, but if I don't know, I mean, case in point, HPV, human papilloma vaccinations, we would get, as the healthcare providers coming into the school, contraception access. I used to be part of, again, this is not even in private, in public health, where it is the school governing bodies that are up in arms against healthcare providers coming in and being part of the system. And fair enough, from the government or from the Department of Health side, what we didn't do well when we wrote that manual, it's very good, except for one thing. We did not include the parent. And we assumed the parent will just think, this is good, sure, give it to my child. No.
But you got the opposite reaction.
Exactly.
Yeah.
We have to go back to the parents and say, firstly, we need to educate the parents. Just because we are talking about sexual and reproductive health and well-being, it doesn't mean we are teaching your children about sex or we are encouraging them. In fact, research over and over proves that the more accurate information you give, the better choices the teenagers are able to make. And the less taboo you make it, I don't need to know about what things go inside, what things at 13, 14 years. But please tell me why my body is doing the things that it's doing. For a boy, why am I having wet dreams? For a girl, what does menstruation mean?
Yeah.
And you explain just the basics of what that looks like. Yeah. And so it's the uneducated parents not being able to fill the gap of what the child needs that then just propels this whole cycle of teenage pregnancy.
Sure. Thank you so very much.